there is a reduction in the placental flow during the contractions, which reduces the efficiency of gas exchange. The relaxation in between the contractions allows the flow to improve. But as you know, we have many parameters which affect the progress of labor. The syntocinon that we may use to augment the labor, the speed of progress, the descent of the baby, the force of the contractions and everything. If there is a sign that the fetus is not tolerating, that's why we have the monitoring of the fetal condition, CTG, if you're listening to the fetal heart rate and everything. If there is any sign, you try to reduce this by improving the maternal posture, side lying, which reduces the compression of the IVC in the mother, improves the blood flow, and improving the maternal oxygenation, which may improve the oxygenation in the fetus. And if the mother's blood pressure is low, correct the cardiac output. So this is fetal resuscitation, which is the first step when you think that the fetus may have less tolerance of the labor process. So what are the problems that can be encountered during the labor process? It can be a prolonged labor. This can happen because of the cephalopelvic disproportion, or the contractions are not happening properly. The contractions are too strong or too frequent. And when we use a medication, we should be very carefully titrating the dose. And that's why it's very important that the midwives and the nurses are closely monitoring the fetal heart when the drugs are increased oxytocin. And if the fetus is compromised due to growth restriction, which itself may be a sign of placental insufficiency, the tolerance of the labor process will be poor. We may also have infection, which may affect the ability. It reduces the fetal reserve to tolerate the labor. So the baby has a higher chance of not tolerating the labor process. There may be obstruction to the cord as part of the progress of labor. You may have cord accidents, cord prolapse, a knot in the cord compression. And we may have abnormal separation of the placenta, which is abruption.